Enough teasing you. Let's bring up the case. I'll put 5 minutes on the clock for reading time. Your time starts now. All right, time is up, and this case is probably going to throw a lot of people for a curveball. Rest assured, it's similar to the last case. It doesn't matter necessarily what you say, it's making sure you have an approach to this case that's sensible, rational, and shows some thought. So, bring it back up on the screen here. The first question here would be what would be your initial steps in developing the disaster management policy? And so the first thing is to actually start by conducting a comprehensive risk assessment to identify what are the kinds of natural disasters or relevant causes, in this case, most likely cyclones or floods. And that would involve reviewing past incidents and consulting with local emergency services. You could also engage with local key stakeholders such as clinic staff, local emergency responders, community leaders to understand current capabilities and potential areas for improvement, and audit the clinic's current resources, including medical supplies, communications tools, backup power systems, which would be essential to gauge your clinic preparedness level. Next question then is what are the essential elements that should be included in such a policy? And so the policy should include the emergency response protocols, so clear steps for staff to take during a disaster, such as patient evacuation, securing medical equipment, and assigning roles such as an emergency lead, a communication officer, organising continuity of care, so procedures to maintain essential medical services such as securing access to chronic disease medications and emergency care for higher risk patients. A communication plan, so internal communication for staff, such as group messaging platforms or satellite phones, and external communication for patients in the community, whether this be coordinated locally with radio announcements or social media. Resource management, so strategies to maintain adequate supplies of medications, water, and fuel for generators. And in terms of partnerships and support networks, details of collaboration with nearby clinics, hospitals, and other local authorities for resource sharing and backup support. Next question would be, how would you ensure that the clinic staff are prepared for future disasters? So this would involve implementing regular training sessions and simulation drills to practice for emergency response protocols, and also to help identify gaps to build staff confidence in their roles, and cross-training staff for multiple responsibilities to also provide flexibility during a crisis. Additionally, all staff should be up to date with their first aid and basic life support training. Next question is, how would you involve the community and local partners in the disaster management plan? And if you've done a bit of thinking, you may have already covered parts of this from previous questions, but engaging the community and local partners would involve holding information sessions to educate residents on how to prepare for disasters and how the clinic will function during a crisis, building partnerships with local governments, NGOs, and emergency services to ensure a coordinated response and resource sharing. Recruiting and training any volunteers as well from community could also provide additional support during a disaster. Continuous review and improvement then. So what measures would you take to keep the policy effective and up to date? And that would involve scheduling routine reviews such as annual or following any disaster or drill to assess the policy's effectiveness. Feedback mechanisms from staff and patients post events would also inform updates, and to ensure that lessons learned from each incident are incorporated into the policy to keep it relevant and robust. And of course, what challenges might you face in developing and implementing this policy, and how could you address them? Well, challenges could include, surprise, surprise, limited funding for primary care, which would also impact on resource gathering, such as backup generators or additional training. To address this, you could explore grants and funding opportunities from local governments and NGOs, but another barrier could also be, of course, staff resistance to new protocols. This can be mitigated by involving staff early in the development process to give them input into how they feel things should run as well, and highlighting the importance of their safety and the importance of continuity of patient care. And that would wrap up the case. So again, yes, it's a bit of a curveball, a bit of a doozy, but really it's about thinking through how actually would you approach it, and starting from that kind of preparedness level through to what other resources are available and how can we use that to provide ongoing patient care. This is one that the questions will often guide through the kinds of responses that people are looking for. And so as long as you're coming up with some kind of structure or sensible kind of approach to it, I think you're going to get through. Each exam has one or two of these curveball questions that are designed to trip you up a little bit and to get you thinking in a way that you may not have necessarily been prepared for. Now, we do have in from the chat here from Keshminda, have a town meeting with paramedics, local hospital, fire and police. Fantastic. And monthly meeting would be good. Yes, that having those regular contacts to provide continuity as well, particularly in rural remote areas. Staff turnover is a problem. And as old staff leave, new staff come in, it's also a great opportunity to bring them in and get them up to date with what's going on. So I love that response. Having a one-stop centre as a triage to answer question 2, also fantastic. As point number 2, yes, it's always important to try and build redundancies in as well, because you never know if the one-stop centre gets taken out in a disaster, does the whole plan fall apart? And of course, it would be good for the clinic to have a backup generator or solar panels with battery. So yes, again, ensuring that ongoing power supply should the other standard kind of ways to build energy gets taken out. Brilliant. We'll stop the clock on that one then. So there we go. Now, for the exams, it's not always a question quite like that. Now, RACGP do actually have a disaster preparedness for clinics kind of module that they encourage people to read through. But if you actually go through the RACGP website, for the information for practices, you'll often find things like this that may just appear in exams. You'll see some of the topics come up from time to time. For instance, one of the other questions that has been seen before is things like a complaint's put to the clinic. How would you set up a policy to make sure complaints are appropriately handled? And so again, it's more thinking through that systems approach to running a clinic, almost looking from that business side of thing, as if you're one of the practice principals. How are you going to actually run the organisation, not so much just the general patient care?